Welcome to the Center for Hip and Knee Surgery. We're pleased that you've chosen our nationally recognized joint replacement program for your total knee replacement. At the center, we're committed to providing the highest quality patient care with the latest advancements in joint replacement technology, state-of-the-art surgery suites for decreased infection rates, and dedicated healthcare professionals specializing in the needs of orthopedic patients. This video will help you and your family prepare for your knee replacement surgery and recovery. The topics we'll cover include anatomy of the knee, the risks of surgery, how to prepare your home for after the surgery, what you can expect during your hospital stay, caring for yourself after you leave the hospital, and exercises to do before and after your surgery. We encourage you to watch this video with your family and support team to give them a better understanding about joint replacement surgery and what to expect. As you prepare for your surgery, it's important to remember that you're not alone. A team of dedicated, highly skilled healthcare professionals will be at your side throughout this entire process. Our goal is to help you regain independence, mobility, and to free you from pain. We've helped thousands of people who suffered with the effects of joint pain, primarily caused by arthritis, who are now embarking on new and exciting life journeys. The Center for Hip and Knee Surgery is dedicated to getting people back on their life journeys and back to the activities and people they love. This dedication is why we perform more than 1,400 total joint replacements each year. The Center for Hip and Knee Surgery has received a number of honors for quality and outstanding outcomes, including being rated #1 in Indiana for joint surgery by Healthgrades, the leading healthcare ratings company, rated 5-star for joint replacement, honored with the Healthgrades Joint Replacement Excellence Award, and nationally recognized as an Orthopedic Center of Excellence. The Center for Hip and Knee Surgery was founded in 1986 by joint replacement pioneer Dr. Merrill A. Ritter and was the first facility in Indiana to specialize in joint replacement surgery. Our surgeons are all specialists in total joint replacement, board certified by the American Academy of Orthopedic Surgery, and are respected leaders in their professional organizations. In fact, they're nationally recognized leaders in their field, treating patients from all 92 Indiana counties, the Midwest, and even foreign countries. Merrill A. Ritter, orthopedic surgeon, retired. Dr. Ritter is the founder of the Center for Hip and Knee Surgery. For decades, he was a professor at both the Indiana University School of Medicine and the Louisiana State University School of Medicine. Dr. Ritter is a respected researcher, lecturer, and author with national and global acclaim. He's also president of the Indiana chapter of Operation Walk, a charitable organization dedicated to bringing mobility and relief from pain to the people of third world nations. E. Michael Keating, orthopedic surgeon. For years, Dr. Keating was an associate professor of orthopedic surgery at Louisiana State University Medical Center. With over 30 years of excellence, his specialty is total joint replacement. Dr. Keating is an active member of many highly regarded professional organizations, and his research of the hip and knee has been showcased in many respected medical and surgical journals. Philip M. Ferris, orthopedic surgeon. A former faculty member at the renowned Indiana University School of Medicine, Dr. Ferris is a skilled surgeon with over 30 years of experience performing joint replacement surgery. A groundbreaking researcher in elbow, hip, and knee replacement, as well as prosthetics, Dr. Ferris's research articles have been published in numerous professional medical and surgical journals. John B. Meeting, MD, orthopedic surgeon. A graduate of Indiana University School of Medicine, Dr. Meeting has over 2 decades of joint replacement experience. He's also specially trained in shoulder disorders and sports medicine. Dr. Meeting has authored and co-authored research articles that have appeared in nationally and internationally published medical journals and has made a number of national presentations at professional conferences. Michael E. Barron, MD, orthopedic surgeon. A graduate of the Duke University School of Medicine, Dr. Barron has over 15 years of experience in joint replacement surgery. He holds the distinction of being selected as an INSAL Traveling Fellow, where he received top-notch international training and instruction. Dr. Barron's research has been published in many journals, and he has also been recognized as a respected presenter at notable national and international symposia. Robert A. Malinczak, MD, orthopedic surgeon. A graduate of the Duke University School of Medicine, Dr. Malinczak has over a decade of joint replacement and sports medicine experience and even consulted for the U.S. national soccer team. His articles have appeared in national journals, And Dr. Malenzak is the lead author of the acclaimed textbook, First Aid for the Orthopedic Boards. Just as you've prepared for surgery with your physician, you'll also need to prepare for when you return from your stay in the hospital. First, you'll need to decide who will help you for the 2-week period following your surgery. Because this person will need to be with you all the time, we recommend a spouse, relative, or close friend. This person will help you prepare meals, bathe, dress, and bring you the things you need. Keep in mind that you'll need some assistance after those first 2 weeks, but your helper won't have to be with you all the time. If you don't have a family member available, please call the hospital's case management at area code 317-834-9524 for assistance. And rest assured that there are many other options available for post-surgery care based on your physical needs and insurance coverage. If you're going to return home after your surgery, there are a few things for you to do in preparation. You should definitely cook some meals ahead of time and put them in the freezer. This will allow you to rest more on days when you're tired during your recovery phase. Also, move frequently used kitchen items and utensils to waist height. You'll also need to pick up all those throw rugs, as they can catch in your walker and cause you to fall. Assure that there is a clear path without rugs, electrical cords, or other items that would prevent a clear path of movement with a walker in frequently used rooms. Next, prepare the bathroom. If you can, have someone install a safety handrail next to the toilet. This will help you get up and down from the toilet. If you have a shower, purchase a shower chair to sit on. If you have a bathtub, purchase a tub chair and a hand device for the shower head. This will allow you to transfer over on the seat and safely take a shower. Your shampoo, soap, and towels should all be available to you without bending. It's advisable to obtain a walker, reacher, and elevated toilet seat to assist you when you return home. These items are available at many pharmacies, but can be purchased at the hospital. Keep in mind that this equipment will not be included as part of your hospital bill because it comes from an outside company and may not be covered by your insurance. Now, let's think about what to pack. You'll need comfortable pants that are easy to pull up and down. Sweatpants or lightweight cotton pull-on pants are a good example of clothes that will be easy to wear during this time. Remember to pack your toiletries and a robe. Also be sure to pack a good pair of shoes with a low heel and a rubber sole. You'll have some pain after surgery, which the nurses will help you control, but you must participate in physical therapy. Therapy is the best way to avoid complications and get you back to the exciting destinations you have planned for your life journey. On the day of your surgery, you'll be given a time to report to the hospital. Please be punctual so the nursing staff has time to properly prepare you for surgery. When you arrive, enter through the main entrance and go to the admitting department. Keep in mind that you may need to have blood drawn. This is because some blood tests must be performed right before the actual surgery time. You'll then report to the surgery waiting room. When the nurse is ready, you'll be taken back to the pre-op holding area. There, you'll put on a gown, have an IV started, and answer some questions. While there, you'll speak with the anesthesiologist, who will explain what they'll be doing during your surgery and give you information on controlling pain after your operation. Just prior to your surgery, your anesthesiologist may place a catheter in close proximity to the nerve or nerves in your leg that send pain messages up through your spinal cord. Through this small tube, a continuous flow of medicine is delivered that will reduce and block pain signals from getting through to your brain. The device that accomplishes this is a small pump that will stay with you until the tube is removed from your leg. These pumps can be very effective in reducing your pain after surgery. Your anesthesiologist will explain this procedure and any risks involved. You'll be able to have 2 people stay with you until you leave for surgery, and the staff or chaplain will be happy to pray with you prior to your operation. When it's time, you'll say goodbye and be taken to the surgery room. The surgery room is cold to help prevent infection. You'll also see a large square above your head around the surgery table. This is called a laminar flow hood, and it filters the air to prevent infection in your wound. We take extra precautions, such as this special filtration system, to provide you the best care possible. The anesthesiologist will give you some medicine, and you'll soon be sound asleep. When you wake up, you'll feel tired and groggy, which is perfectly normal. You'll be in the recovery room, also known as the Post-Anesthesia Care Unit, or PACU. There, you'll be taken care of by a specially trained nurse who will monitor your heart rate, blood pressure, and other vital signs to assure that you're coming out of the anesthetic with no problems. If a problem
As you prepare for your upcoming knee replacement, it's important to understand the benefits of exercise, both before and after your surgery. Exercising before your surgery will help you build up your strength and maximize your range of motion once your knee is replaced. It'll also be easier to do the exercises because you'll already be familiar with them. Exercising after the surgery is nearly as important as the surgery itself when it comes to ensuring a good outcome. You must tell yourself that this is an active recovery period, not a passive one. That's because once you leave the hospital, there's much work to be done in order for the muscles and soft tissue around your new joint to properly heal. Every time you go through your exercise program, you'll gain mobility. And if you don't perform your exercises frequently or 5 times a day, your knee will most likely tighten back up to where you started from, what we call a stiff knee. Remember, the 2-month period that follows your surgery is a critical time to regaining your mobility. That's because your body begins forming scar tissue as it heals. And scar tissue that's not allowed to move and stretch early on will harden and limit your range of motion and your ability to function normally. With that in mind, be sure to make these exercises part of your daily routine, just like brushing your teeth or getting dressed in the morning. You might even find it helpful to schedule your exercises at a specific time every day. In addition to strengthening and stretching your knee before surgery, focusing some attention on your upper body can be beneficial as well. After your surgery, it may be difficult to get in and out of bed, and even get up from a chair. You'll also rely on your arms for stability and support when using your walker or crutches. Having good upper body strength will help you perform these tasks. And doing the following exercise will help you achieve this. Sit in a firm chair with your hands flat on armrests or on the seat. Lean forward and use your arms to lift your hips up, off the chair. Slowly lower your hips back down. Repeat this 10 times. This exercise strengthens your arms, which will help you initially get out of bed and to later use your walker in order to get around. For your knee exercises, you'll need to find a comfortable surface, usually your bed, where you can lie down and perform them without interruption. Remember to do 10 repetitions 5 times a day. Prior to surgery, use pain as your guide and don't perform any exercises that create serious discomfort. After surgery, there's usually some pain that you'll need to work through, but you can lessen this pain by doing your program 30 minutes after taking your pain medicine and icing your knee for 15 minutes after you're done. Lie down with your knees straight. Slowly and deliberately move your feet up and down by bending at your ankles. Do this 10 times. This exercise stimulates circulation in your lower legs, helps prevent blood clots, and stretches out your calf muscles, which you use to straighten your knee. While still lying down, tighten your thigh muscles by pressing the back of your knees down into the bed. You may feel your kneecap draw upward. Hold this position for 5 seconds and then relax. Repeat this 10 times. This exercise stimulates the quadriceps, the large group of muscles in the front of your thigh that you depend on for standing and walking.